whilst I believe that in every respect he has acted responsibly and legally and with integrity, and with the overwhelming aim of stopping the spread of the virus and saving lives. And I stress this fundamental aim because it's thanks to this country's collective resolve in achieving that aim that we continue to make progress. So let me give you today's figures. 3,458,905 tests for coronavirus have now been carried out in the UK, including 110,401 tests carried out yesterday. 259,559 people have tested positive, and that's an increase of 2,409 cases since yesterday. Smaller increase than we were seeing over the last few weeks. 8,951 people are in hospital with COVID-19 in the UK, down 11% from 10,085 this time last week. And sadly, of those tested positive for coronavirus across all settings, 36,793 have now died. That's an increase of 118 fatalities since yesterday. And each of those fatalities represents a family in mourning, the grief of friends and relatives. And as we mourn them, we resolve again to beat this virus and get our country back on its feet. And we can and we will. 2 weeks ago, I set out the government's roadmap to begin easing the measures we put in place to control the spread of coronavirus. I said that we would do so in a safe and controlled way, based on our assessment of progress against the 5 tests we set for adjusting the lockdown. We're going to set out that assessment in detail in the coming days, but today I can confirm that I do believe we will be in a position to move to step 2 of our plan. As part of step 2, we set out plans for a phased reopening of schools, because the education of our children is crucial for their welfare, their health, for their long-term future, and for social justice. And so, in line with the approach being taken in many other countries, we want to start getting our children back into the classroom in a way that is as manageable and as safe as possible. So we said we would begin with early years settings and reception, year 1 and year 6 in primary schools. Early years reception, year 1 and year 6. And today I can announce that it is our intention to go ahead with that as planned on June the 1st, a week on Monday. We then intend, from June the 15th, for secondary schools to provide some contact for year 10 and year 12 students to help them prepare for exams next year, with up to a quarter of these students in at any point. And by opening schools to more pupils in this limited way, we're taking a deliberately cautious approach. And this comes after a constructive period of consultation with schools, teachers and unions, led by the Education Secretary, Gavin Williamson. I want to thank all the teachers, education, childcare staff who have stepped up to the challenge and kept schools open throughout this crisis. The Department for Education will engage with teaching unions, local authorities and school leaders in the coming days, giving them an opportunity to ask questions and probe the evidence behind our plans. And the final decision will be taken as part of the formal review into lockdown measures which the law requires us to undertake by Thursday. We will, of course, continue to consider all the evidence, as we said we would do, and we will continue to work hard with those bodies over the course of the coming week. But I think it is important for us to be clear about the government's intentions now, so that teachers and parents can plan in earnest for schools to reopen a week on Monday. Now, I acknowledge that a June the 1st opening may not be possible for all schools, but the government will continue to support and work with the sector to ensure that any schools experiencing difficulties are able to open more widely as soon as possible. Detailed guidance has been published by the Department for Education on how schools can open in a way that is safe for children, teachers, and parents. While, of course, we recognise that full social distancing may not be possible, especially when teaching young children, our guidance sets out a range of protective measures to keep children and staff safe. This includes reducing the size of classes and keeping children in small groups without mixing with others, staggered break and lunch times, as well as drop-offs and pickups, increasing the frequency of cleaning, reducing the use of shared items, and utilising outdoor space. All children and staff and their families will have access to testing if they display symptoms. And this will enable children and staff to get back to school if they test negative, and if they test positive, we will take the appropriate reactive measures. We will continue to work with the sector to support them to prepare for wider opening and ensure all children and young people can continue to receive the best care, education, and training possible. We will set out what moving to step 2 means for other areas, such as non-essential retail and more social contacts, over the course of the next week. So let me stress again in conclusion. We are making good progress, but that progress is conditional, provisional. We must keep reducing the incidence of this disease. We must keep that R down below 1. And that means we must all remember the basics. Wash our hands, keep social distance, isolate if you have symptoms, get a test. We are beating this thing, but we will beat it all the faster if we stay alert, control the virus, and save lives. I now turn to Steve Powis, National Medical Director of NHS England, to present today's data. Steve.
Thank you, Prime Minister, and good afternoon, everybody. If I could go through today's data slides, with which I'm sure you are all familiar. So as ever, the first data slide is in respect to the effect of social distancing on our transport usage within the country. And you can see, as we have shown you before, that when it comes to vehicles, cars, light goods and heavy goods vehicles, there's been a gradual increase following an early decline. But in public transport, in national rail, Transport for London and non-TfL bus routes, you can see that there's been a dramatic decline and that reduction in travel has been maintained over the period of the social distancing measures. On the next slide, we take a look at the testing programme and the new positive cases of COVID-19 that are arising from that programme. And firstly, you will see that in the upper graph, there has been a large increase in testing and indeed in testing capacity in recent weeks. You will see in the bottom graph that we continue to see new confirmed test positive cases, but even with an increase in the testing programme, they have maintained steady or indeed have started to drop, which reflects that we are seeing less virus, less transmission of this virus in the community and therefore lower rates of infection. And then the next slide shows how that data then translates into our hospitals. And clearly for the vast majority of people, this is a mild illness if you catch the virus. But unfortunately for some, symptoms and the complications do require hospitalisation. And you can see the data here on the new daily admissions into England with COVID-19. You can see that peaked in April, but has now been steadily declining in recent weeks, again reflecting lower transmission rates in the community. And then for our unfortunately sickest patients who require some time in our critical care facilities, our intensive treatment units, and unfortunately need mechanical ventilation to support their breathing, then you can see in the lower graph that there has been another fall since April in all parts of the country in the percentage of those beds in intensive care units that are occupied by COVID-19 patients, again representing the reduction of cases in the community and therefore less critically ill people coming to our communities. And then on the next slide, we can see general data on the number of people in hospital with COVID-19. And you can see that compared to last week, there has been a fall from 10,085 to 8,951. So a continued fall in the number of hospital beds that are occupied with patients with COVID-19. And again, in the graphs that you can see that there is some variation around the country as to this. London, as I've said before, had the biggest peak and the fastest reduction, but you can see in other parts of the country that they again are coming off a plateau of numbers of people in hospital, and there is overall a sustained decline. And then finally, and unfortunately, we go to our slide on the number of deaths in the UK. And again, you will be familiar with this. As I've said before, the daily count does vary from day to day, and particularly at weekends where we have a reporting lag, and especially at bank holidays where that might be 3 days rather than 2. But the important aspect of this particular graph is the 7-day rolling average, which takes out that day-to-day variability. And you can see that once again, we are seeing a steady but sustained decline in the number of deaths, again reflecting success in reducing the transmission of virus in the community. Thank you.
Thanks very much, Steve. Well, we're going to go for some questions first from the public and then from the media. First, we go to Penny in Hampshire.
As this is a global pandemic, how is the government working with other countries to find solutions to vaccines, tracing gaps, etc., rather than everyone working on their own solutions?
Well, thanks. I'll ask Steve to comment on that as well. But Penny, thank you very much for that question, because I do think one of the most depressing things about the way the epidemic ripped through the world was that there was a kind of devil take the hindmost approach amongst so many countries that scrabbled to get their own share of very scarce resources such as PPE, personal protective equipment, or enzymes for testing, and a real fight took place across the world as we tried to protect our own populations. And you could see that this was something that was a global problem, Penny, as you rightly say, a global pandemic that produced everywhere a national response. And we in this government want to see a much more international approach. We want to see the nations of the earth coming together to produce the long-term solutions, particularly in vaccines. And that's why on June the 4th, the UK is holding a big summit. I mean, we've got huge numbers of countries participating that are going to pledge very, very considerable sums, we hope, into finding a vaccine. Different people have different levels of optimism about whether Jenny will get a vaccine this year, next year. But I'm hearing more and more signs of confidence about our ability to do it. And I certainly think that we'll do it all the faster if we collaborate across countries and across scientific communities. So the UK is definitely leading in that effort. Steve, any
Yes, so thank you, Penny. So of course, science is a global endeavour. And I think it's been really heartening how scientists across the world have rapidly come together and rapidly advanced the pace of not only our scientific understanding of this completely new virus, but also in terms of working through the biology and then through to the sorts of treatments and therapeutics that might be used. Not just for vaccines, as the Prime Minister has said, but also in terms of using drugs, some of which are drugs that we use in other contexts, and rapidly working through clinical trials, some of which are international, some of which are in individual countries, to try and determine which drug or which combination of drugs might be capable of treating and modifying the effects of this virus infection. So, as I've said before, I think it's remarkable how quickly science has progressed. But there are still challenges ahead, and we don't underestimate the amount of new science that we need to learn and the challenges such as vaccine development. But I can be confident that that will be a global effort. And of course, the UK is very strong in life sciences. We have a long history of science, and particularly biological science, very strong universities, and they will be contributing to the global effort.
Thanks very much, Penny. Thanks, Steve. Can we go to Kate from Woking? Sorry, I've got to read that. Sorry, forgive me. Kate from Woking asks, our school has decided it's not possible to accommodate children of critical workers alongside reception year 1 and year 6. Will the government, teachers' unions and head teachers work together to find a plan that will provide for all children at home or in school in September? Kate, look, I totally understand the difficulties that your school faces. This is going to be tough, and I repeat my thanks to all teachers and educational staff who actually worked very hard to keep schools going for vulnerable children and the children of key workers throughout the last 10 weeks. What we will do is make sure that we stagger things and we pace things, and we work directly with you, with local authorities, to make sure that there is a plan. And you've heard some of the measures that I outlined today. I think the really important thing to ensure that we get everybody back and this whole thing up and running by September at the very latest is just to keep pushing down the incidence of that disease, to keep pushing that R down. That's going to be the most effective way to ensure that not just our schools but all our economy is ready to go back as fast as possible. Steve, anything you want to add on that?
The only thing I would add, Kate, is just on behalf of all my colleagues, the staff in the NHS who've worked so magnificently through this surge in the virus, how grateful everybody is to our colleagues in schools, to school teachers, and those that work in schools for keeping the children of our staff safe at school and to continue schooling during the last few months. Everybody's very grateful.
It's been absolutely critical. So thank you. Could we go to the media now, please? Ian Watson from the BBC. Ian. I think you need to unmute Ian. Can we get Ian's audio? I can kind of lip read, but I think we're going to need to. I'm so sorry. I'm so sorry, Ian. Can we come back to you? I think we'll go to Robert Peston of ITV. We'll come back to you, I promise. If we sort out your audio, we'll come back to you.
Hello.
Robert.
Disaster. Hello, Prime Minister. Hello, Professor Paris. Good to see you both. The simple agreed facts in this case are that Dominic Cummings, in a prima facie sense, breached three. Hello, can you not hear me?
No, I can hear you well. Keep going.
Oh, sorry. It's all technology's working so well. As I say, the agreed facts are really simple. Dominic Cummings, your aide, in a prima facie sense, breached 3 of the lockdown rules. He left the house when somebody was living with had coronavirus symptoms. He was in a confined space with that person, in this case a car, for several hours, and he went to a second home. I just want to be clear, Prime Minister, in saying that he behaved honourably, did the right thing by trying to put in place childcare arrangements. Are you saying that if somebody is in the same position as Dominic Cummings and has the same childcare concerns, they are completely at liberty to do precisely what he did? Yes, no, not sure. And secondly, retail businesses need a bit of time, shops need a bit of time to prepare to open. Are they opening on June the 1st?
Thanks very much, Robert. And first of all, I really just want to repeat what I said earlier on. Looking at the very severe childcare difficulties that presented themselves to Dominic Cummings and his family. I think that what they did was totally understandable. There's actually guidance about that particular difficulty, about what you need to do, about the pressures that families face when they have childcare needs. He found those needs where they could best be served, best be delivered, and yes, that did involve travel. But I have to say, I think that looking at the situation, I think any father, any parent would frankly understand what he did. And I certainly do, and I spent a long time talking to him about it today. And on your point about the future and June the 1st, well, all I can say, Robert, is watch this space. You will have heard me say what I've said. We remain firmly on that roadmap, but we are proceeding in a way that is provisional, that is contingent, that is entirely dependent on our ability to continue to make the progress we are currently making in pushing that R down, defeating the virus. And you'll be hearing more about that in the next few days. Is Ian back? I think Ian, no, sorry, thank you. We'll come to Ian as soon as we can. We'll go to Gary Gibbon of Channel 4, please.
Thank you, Prime Minister. I'm a bit puzzled. You've had this long chat with Dominic Cummings. You said he went where he could get childcare. I thought he's now saying he didn't receive any childcare, but did all the childcare himself. You say he drove up the road when he was about to be incapacitated. He didn't know that. He couldn't know that. Could he? And you say, more alarmingly, really, you say he was following instincts. The rest of the country was following rules, not instincts. Are we now all entitled to follow instincts? Where will that leave it when a tracer goes round to someone and says, well, you have COVID, I need you to isolate? Well,
Gary, as I've said just now, the guidance makes it very clear that where you have particular childcare needs, that has got to be taken into account. And as I've said, I've looked very clear. I've seen a lot of stuff in the last few days about this episode of self-isolation by Mr. Cummings that does not seem to correspond remotely with reality. And as far as I can see, he stuck to the rules, and he acted legally and responsibly, and with the sole objective of avoiding such contact as would spread the virus.
He got the virus probably in the train, in the car, didn't he?
Well, his objective was to stop the spread of the virus, and he behaved in such a way as to do that. Can we have Charlie Cooper? No, we're going to go back. Sorry, thanks, Gary. We're going to go back to Ian Watson of the BBC.
Yeah. Okay, Prime Minister, can you hear me now?
I can, yes.
Excellent. So for better or worse, I haven't entirely been silenced.
No, forgive me.
Conservative MPs have got in touch with us today, Prime Minister, because they say lots of their constituents are angry. They feel that allowing somebody who was already ill to travel 250 miles across the country breaches at least the spirit of your guidance. Hand on heart, can you really say that this didn't breach the spirit of your guidance? When were you told that Dominic Cummings was making this trip, and did you approve that trip? And can I also ask another question, just in case I get muted again? And that is this. You said that some of the stories in the press were palpably untrue. Can you clear up one story which your ministers and indeed your press officers haven't been able to clear up? Did Dominic Cummings make a trip to Barnard Castle in April when he was isolating, or at least was based, in Durham?
Right. Well, Ian, what I can tell you is that I think when you look at the guidance, when you look at the particular childcare needs that Mr. Cummings faced at the time, it was reasonable of him to self-isolate, as he did for 14 days or more, with his family, where he did. And I think that was sensible and defensible, and I understand it. And as for all the other allegations, again, I just repeat what I've said earlier on. I've looked at them carefully, and I'm content that at all times throughout his period in isolation, actually on both sides of that period, he behaved responsibly and correctly and with a view to defeating the virus and stopping the spread.
But some Conservative MPs are saying, Prime Minister, that this defence that Dominic Cummings behaved responsibly, many of their constituents are angry about that.
Yes, well, let me just say...
As though they were irresponsible in not breaching guidelines and going somewhere close, perhaps to their family during this lockdown, and they feel insulted by that. So what would you like to say to their constituents? Because that's where the postbag is coming in.
Of course, and I understand that. I understand that.
Out at that kind of language.
I understand that, and I think that one of the reasons it's so important, and one of the reasons I was so determined to come and talk to everybody about this, is because I can totally get why people might feel so confused and, as you say, so offended by the idea that it was one thing for people here and another thing for others. But really, having looked at what happened, having looked at his intentions and what he was trying to do for the good of his family, I really think most people will understand what he was doing, and above all, what he did. If you look at the measures that he took, they were designed to stop the spread of the virus. And I think that he, at all times, as I say, behaved responsibly and legally. Though Ian, I perfectly accept the point that you make, and that's why it's so important. That's why I wanted to come out and make these points this afternoon. Can we go now to Charlie Cooper of Politico?
Hello, thank you for having me.
Thank you.
Prime Minister, you say that Mr. Cummings had no alternative, but what is your definition of no alternative in this context? And it's a really important question because there's a question of the ongoing advice to the public here. Is it now government advice that if you have symptoms but are concerned about childcare, have no alternative, in your words, you don't necessarily have to stay at home, but you can travel to another home, maybe in a nicer part of the country, if you're lucky enough to have access to one? Is that the new advice?
The advice remains unchanged, Charlie, and that is that if you have symptoms, then you should self-isolate for 14 days, and that's what Mr. Cummings and his family did. Scott McNabb from The Scotsman.
How Mr. Cummings' actions... If the advice remains unchanged, can you explain how Mr. Cummings' actions were not in breach of the advice?
Sorry, can we go? Because the advice makes it absolutely clear that if you have particular childcare issues, then that is a factor that has to be taken into account. And when I look at what actually happened, Dominic Cummings and his family self-isolated for 14 days, and that is what you've got to do. And there was as I said at the outset, there was a risk that they would not have, if they both went under in such a way as to be unable to care for their child, to get to your point, then they might have needed the help of relatives who were living nearby who could come in a socially distanced way. As it happened, that was not necessary for medical reasons I don't want to go into. But that was the risk, and I think it was a real risk, and I think it was absolutely responsible of Dominic Cummings to see the risk to his family, to see the risk to his child, and to take steps to avert it, and that's what he did. So, and that in no way changes the guidance or the advice. Could we go to Scott McNabb from The Scotsman, please?
Yeah, thank you, Prime Minister. In Scotland, our former Chief Medical Officer resigned after a late-night conversation with Nicola Sturgeon. When it emerged, she had breached lockdown rules, travelled to a second residence in another part of the country. The reason she had to go, we were later told, was because keeping her on risked undermining the public health campaign to keep the virus under control. Is there not a real danger that if Mr. Cummings remains in place, people may choose to disregard these lockdown restrictions and so undermine the progress we've made so far in suppressing the virus?
No, because the sharp distinction is that unlike the lady you mentioned, Mr. Cummings actually went into lockdown because he had symptoms, went into self-isolation for 14 days or more, and that is what you should do. And the particular circumstances of his isolation, as I've said now several times, were determined by the childcare needs of the family. Erin Lyons from the Oxford Mail.
Good afternoon, Prime Minister, Professor Powers. This week we reported on the death of Peter Gough, an administration assistant at Oxford's John Radcliffe Hospital, who died from coronavirus after raising concerns he didn't have access to PPE or any hand sanitizer, even after the death of 2 porters at the same hospital. The managing trust has said it followed national guidance, and no staff members who don't have direct contact with patients need PPE, but the family and friends believe he died unnecessarily and should have been better protected at work. To Professor Powers, what is the evidence and rationale behind limiting PPE in this way in hospitals? Is it entirely science-based, or is it down to limited resources? And to the Prime Minister, an Oxford doctor who works in intensive care in the city had coronavirus in March, had a 4-month-old baby at home, but he said he followed the guidance, which he saw as incredibly clear, and stayed in lockdown throughout. If the government guidance included the exemption that Mr. Cummings used, why did so many people in Oxfordshire and beyond seem completely unaware of it and at great cost to themselves and their loved ones?
Shall I take the PPE? So on PPE guidance, the answer is yes. PPE guidance is based on the science. The PPE guidance in the UK is developed by our experts at Public Health England, Public Health Scotland and the other devolved administrations, and it closely follows the World Health Organization guidance as well. That guidance has been refreshed a couple of times since we learnt about this virus in January. The last time it was reviewed was now about a month ago. It was the weekend after Easter. And that was done with a huge amount of input from professional colleagues across the healthcare sector, including the Royal Colleges, some of the unions and others. And there was a real consensus around the work on that. I think Public Health England had over 1,000 comments over the course of refreshing that. So I'm confident that the guidance that is in place at the moment, which is that guidance, is not only based on the science, but on the professional input and support of many, many professional groups within healthcare.
Thanks very much, Steve. Well, Erin, I obviously just on PPE, if I could say something, because it has been one of the most difficult and the most intractable and in some ways infuriating aspects of the crisis, the difficulty of delivering PPE in a timely manner, not just to the NHS, by the way, but to care homes and across the whole of the country. I think we're now doing much better than we were a month, 6 weeks ago, and as far as I know, no hospitals currently have stockouts in the way that you described. But I will look at what's happening in the Radcliffe, and I will try to make sure that they get what they need. And thank you for raising that. But on the other issue, of Mr. Cummings and his, and the doctor you mentioned in Oxford, I just repeat my point. I think they're in the same position. Mr. Cummings did isolate for 14 days or more, and the circumstances of his isolation, his self-isolation, were determined by the difficult childcare position that he found himself in, and I understand that, and I think that many other people do. Thank you very much, everybody, for tuning in this evening. Thank you for watching. I think we'll be back again tomorrow. Thank you.